Hi, Suchitra. Hi, Mr. Pankaj. Welcome to the webinar. So as everyone is joining, so once everyone joins, I'll start with the webinar. It will take at least 4 to 5 minutes. Till then, please wait. And of course, I would really like everyone to drop a hi message that at least that you have joined and acknowledge. So if you can just drop me a message so that I can so that it is updated to me, like you can chat with me as well. Hi, Elizabeth. Hello, Miss Kanchan. Yeah, so is my voice better now? Thank you for confirming. Hello, Mr. Chandan. Welcome to the webinar. So, in between, like everyone is joining, so I would really like to give this information that every Saturday we have these webinars and we call it as masterclass as well. So we either the wellness coach or the nutritionist give a presentation on separate topics. So related to IBS only. So definitely this will benefit you a lot. So every Saturday you can join for the same. Yeah, thank you for confirming, Suchitra. So no, I know a lot of you have joined over here, and possibly you all have few doubts related to IBS and the low FODMAP diet. How is it beneficial? How is it going to be like if you enroll on the Daily Bloom app? So I'm going to guide through the presentation how we deal with the IBS, how our nutritionists and the wellness coaches guide you related to IBS, and how you can follow the low FODMAP diet, as well as there are wellness coaches as well on our program. So they guide you for mental wellness and physical wellness as well. Is it better now? Can you hear me more clearly now? If you can just confirm me once by saying yes in the chat section, that will be a confirmation for me. Yes, thank you so much. Thank you for responding. So we'll wait for 2 minutes more and then I'll start with the webinar. Today we'll be dealing with various myths and facts that are surrounded around whenever a person has IBS. And of course, the low FODMAP diet, which we suggest as a nutritionist, I'll be in detail telling you about, giving you all the information related to it. In case you have any doubt or any questions related to IBS, or the low FODMAP diet, definitely you can drop in the chat section so that I can answer you at the end of the webinar. Hi, Ashwarya. Hello, Dr. Manoj, Dr. Sarath. Thank you for taking out time and joining this webinar. I'm really glad that all of you are here. I know they're like everyone is busy with their routine, their work timings, but definitely it means a lot that you all have joined today. Hello, Shivam. How are you? Good evening. Good evening, Mr. Parmeshwar. Hello, Salman. Yes, definitely, Salman. Whenever, at the end of this webinar, I'll take up all the questions. So please drop in the Q&A session or else in the chat section. I will definitely answer to you. I'm good too. Thank you, Shivam. So before starting this whole webinar in today's masterclass, I would really like to introduce myself. I'm nutritionist Katie. I'm working as a lead coach nutritionist at Daily Boom IBS. So in this program, there are various nutritionists as well as wellness coaches. We are dealing with IBS, gut health related issues, and definitely we're helping people who suffers from IBS or any of the gut health issue. So today in this webinar, I'm going to cover the topic separating fact from fiction because there are a lot of myths around the IBS. So today I'm going to explain you in detail about IBS and the low FODMAP diet. I hope my voice is now clear and I'm audible to you all. Yeah, thank you for confirming. So I'll start with the webinar now. So as you can see, like the first thing that I would really like to talk about is the contents. So today I'll be covering the topics, what is IBS, the role of low FODMAP diet, why is it important, what is exactly the low FODMAP diet, and of course the phases that we cover to follow the low FODMAP diet. And of course, I'll be clearing myths and facts regarding that only. So let's talk about what is IBS first. So IBS basically is irritable bowel syndrome. It is a gastrointestinal disorders which affects our life a lot, and it comes with GI symptoms, multiple GI symptoms. In some cases, there is abdominal pain. In some cases, there is bloating. Also, there is change in bowel habits and excessive gas. So whenever I talk about change in bowel habit, it comes under four categories. First is IBS-C, that is IBS with predominant constipation. Then is IBS-D, that is IBS with predominant diarrhea. Then is IBS-M, in which both symptoms, that is IBS, like diarrhea and constipation, a person can suffer from diarrhea for a short period of time and then may develop constipation in the later stage. And also there's this fourth type of IBS, that is IBS-U, that is unclassified yet. So if I talk about the global prevalence or the Indian population, like 11.2% people globally are suffered from IBS, and Indian population around 4.2 to 7.5% are having IBS. As per the researchers, there is no particular cause or there is no exact cause has been identified yet, but still there are different factors which affect the overall IBS, or there are different factors who contribute towards the IBS. So first, I would really like to talk about dysmotility. As even if I talk about the dysmotility, it is related to the motility of food items. So whenever the food item is moving at a higher pace, that is increased motility, a person will face diarrhea. If the food item is moving slowly, that is the motility decreases, so person faces constipation. Other than this, there's a factor called visceral hypersensitivity. There are certain nerves that are present in the gut walls of the gut. They are also very hypersensitive and they are affected. And of course, the gut brain dysfunction. Whenever we talk about IBS, we definitely deal with brain and gut because these are both linked. Whenever there is a miscommunication between our gut, that is our stomach, our intestine, or and the brain, there is a miscommunication, and hence it causes IBS as well, because and the person faces different kind of symptoms. Okay, so the next question is like, what is FODMAP? What do you all think? Like, what is exactly FODMAP? Is it a protein? Is it a carbohydrate? Is it a fat or mineral? I'll wait for your answers in the chat section so that even I get to know how many of you know about FODMAP. Like, what exactly is the term FODMAP means? Yeah, they are kind of sugar. Also, it's more specific form of glucose. Anyone else who know what exactly is FODMAP? Yes, most of you already know that it's FODMAP, but the ones who doesn't know, who are new to here, so I would really like to tell you the correct answer is that the FODMAPs are carbohydrate only. So let's talk about more about FODMAP and what's their role and how we follow the low FODMAP diet. So whenever I talk about FODMAP, so FODMAPs are a group of sugars that are not properly digested, or you can say that are not properly absorbed into our intestine, and they move towards the large intestine that way. Whenever there is high FODMAP content in our body, it attracts more amount of water. The first thing, our water is more in the gut. Second thing, whenever our bacteria that are a gut bacteria, good bacteria, ferment them, they produce more amount of gas. So because of the presence of gas, excessive gas, and of course water, there is that imbalance, or there is abdominal distension, or there may be any abdominal discomfort faced by a person. So I would really like to know, tell you all that therapeutic approach for IBS is definitely needed. And as per IBS symptoms only, that has to be done. Like if a person faces diarrhea, so that accordingly only we have to suggest diet. And if a person faces constipation, accordingly only the nutritionist suggests you the diet. Of course, as the picture says, no more bloating because she has followed low FODMAP diet. So definitely, even I would emphasize on this, like you should follow low FODMAP diet at least in the initial phase, and I will explain how you can follow the low FODMAP diet. So let's talk about FODMAP in detail. Basically, what does that term FODMAP means? FODMAP means fermentable oligosaccharide, disaccharide, monosaccharide polyols. If I talk in the normal language, basically fermentable, that is, fermentation is a process that which are gut bacteria, that are good bacteria, they digest the food, but that is not completely digested, and they produce more amount of gas. Oligosaccharide comprises of both fructose and galacto-oligosaccharide, which are present in wheat and wheat products, for say refined flour, that is maida, and semolina, that is suji. Along with this, these are also present in legumes, pulses, and onions, which are high in FODMAP. If I talk about disaccharides, so lactose is a disaccharide, which the lactose is found in dairy products. So lactose-rich milk or lactose-rich milk products, either say curd, buttermilk, or paneer. These are also high FODMAP. Next is the monosaccharide. Monosaccharide comprises of fructose sugar that is mainly present in our fruits. The fruit sugar comprises of monosaccharide. So definitely we have to keep in mind that overall fructose rich fruits such as apple, mango, grapes, lychee, and other example are as well, which are high in FODMAP. And last but not the least, polyols. Polyols comprises of both sorbitol and mannitol. So these are also found in various food items. So this is the whole FODMAP. So now I would really like to tell you what are the phases that we follow during the low FODMAP diet. There are three phases. Like we don't have to be on low FODMAP diet forever or not. I will clear this with in the next slide, but let's talk about the phases first. First is low FODMAP diet, that first phase is elimination phase, or we say it substitution, detox, or the gut cleanse phase. This phase comprises of 4 weeks. In this phase, what a nutritionist will suggest you is like you substitute the high FODMAP items with the low FODMAP items for a short period of time, that is only 4 weeks. Okay, why we are doing so? Because whenever you are consuming any high FODMAP item, you are facing some of the other kind of abdominal discomfort and other kind of symptoms as well. So to give our gut that relief, or to get relief from the other kinds of symptoms, and to cleanse our gut, we are following the gut cleanse phase or the elimination phase. Next phase comes up, that is the reintroduction phase. Reintroduction phase comprises of 6 weeks, and in this phase a nutritionist will tell you how you can reintroduce the food items one on one. Like for example, I've given you examples of high FODMAP items in the previous slide. For example, first week comprises like we reintroduce fruits. Second week, the nutritionist will ask you to introduce vegetables. Third week will like lactose is reintroduced. Fourth week, wheat and wheat products, and then onion and garlic, and pulses and legumes are reintroduced. But definitely a nutritionist who is well qualified, who is specialized in FODMAP, should be concerned. You should always get this supervision from a registered dietitian or a special professional who can guide you for the same. So in this phase, basically, we are reintroducing certain food items that are high in FODMAP. So what does this phase gives us? Basically, we can find out what all food are suitable for our gut or not. And the third phase is the sustenance phase. That is the personalization phase, where you know that our body is able to tolerate certain type of food items or is not able to tolerate some foods. So accordingly, a personalized diet plan is planned, which you can follow for life as well. So what do you get after following these phases of low FODMAP? Basically, you get the list of food items, you find out all the trigger foods that are causing you IBS. So this is the reason it's very important to follow different phases of low FODMAP diet to manage your overall IBS symptoms. So let's talk about myths now. First myth is IBS is just a minor digestive issue. I would really like you all to answer this question. What do you think? Like, is it true? Like IBS is just a minor digestive disorder or not? Yes, drop your answer in the chat section. Accordingly, I'll know that is it true or not, please. Yeah, a lot of you know already, like you're saying no, it's a major issue. Yeah, so I would really like to clear this myth now. Basically, whenever we talk about IBS, so I would say it's not a life-threatening issue, but definitely a long-term issue. Okay, we have to deal with this issue for a long period of time, and definitely it affects our quality of life as well, because there are certain symptoms that are causing us. So definitely that affects our overall quality of life. And for managing the overall IBS, we require proper management, whether we say about diet or the mental wellness or the physical wellness. Definitely we have to keep in mind, and we have to be in the supervision. Next myth is IBS is caused by stress alone. So as the picture depicts as well, what do you think? Like, is IBS is the only reason that is causing you trigger, or is there any other issue as well, or other causes as well which causes trigger or IBS? Is stress is the only thing that is causing you IBS? Please drop your answers in the questions Q&A chat section. No, like some of you are saying no, it's not the only cause that is causing IBS. Yes, definitely dietary habits, stress, both are the reasons, not just stress. Definitely, there are other factors as well which causes IBS. So yes, let's talk about the fact which the picture depicts as well. For example, definitely I would say like brain and gut is interlinked. So stress can increase the symptoms, but it is not the only reason which is causing IBS. There are other factors as well. First of all, that is diet. Like I've discussed, low FODMAP diet is very important to follow for management of IBS. So if you're including more high FODMAP food items, so you should keep in mind that diet is something which is playing a very major role in managing the symptoms, so you should focus on the diet. Next is gut health. Gut health, of course, if there is any kind of gut infection or there is any alteration in the microbiome, so that will also cause IBS. And genetics, that also affects and that also causes IBS. Next myth, like a low fiber diet is best for IBS. So, what do you all think? Like, is a low fiber diet the best one, or do you think even increasing fiber content gives like relief to you for improving your overall symptoms and IBS? Please drop your answers in the chat section. No, some of you are saying no, a low fiber diet is not best. Okay. So yeah, let's talk about the fact now. The fact is, like I would know, like definitely, if I talk about fiber, fiber is beneficial for overall gut health. Low fiber diet for IBS-D. Yes, definitely IBS-D, that is for the predominant diarrhea. There are different answers that I'm receiving now. A low fiber diet is best one. Even high fiber diet leads to increase of IBS. Okay. So, like, definitely, I'll be giving the answer to this. If I talk about fiber, it's beneficial. It's really good. But it depends from person to person. So, as per the gut health, fiber is important, but the tolerance differs from person to person. Say, if a person is having diarrhea, definitely a low fiber diet is needed. But when a person has constipation, a high fiber diet is needed for that person. So, definitely, we have to keep in mind the symptoms. The nutritionists keep in mind all the symptoms accordingly and then only suggest you the diet. And some high fiber foods may worsen the symptoms. So, like I've mentioned, we have to keep in mind the symptoms that a person is facing, and accordingly, only the professional will guide you. Next myth is the low FODMAP diet is too restrictive. So what do you think? Is it like something which is way too restrictive? Even the picture is depicting something. So if you know about this picture as well, you can answer me in the chat section. Or is it something like, if I talk about the low FODMAP diet, is it easy to follow? Or do you think like, no, it's not that easy? Okay, so you have some of you have answered no, it's not too restrictive. So, if you're saying like it's not too restrictive, so does any one of you know how what are options can be there in the diet? What are you eating to like manage your overall symptoms, improves IBS symptoms? Okay, it is difficult to follow, but not too restrictive. Definitely. If you have someone, a professionalist, a professional dietitian who is guiding you throughout the time, so definitely I would say it's not restrictive. Maybe because of the routine or the food items that you're including, it's a bit difficult, but not really restrictive. You can enjoy a lot of food items during the low FODMAP diet as well. Okay, like restrictive when we go out for eating. Okay. So let's talk about the fact that comes with it. Like the low FODMAP diet, like in the initial phase, like I've mentioned, in the elimination phase or the gut cleanse phase, there is restriction of high FODMAP items, and we have to be dependent on the low FODMAP items. But with the elimination phase, there comes a phase of reintroduction, where we reintroduce food items that are high in FODMAP. And as your tolerance is checked, as we are able to identify the trigger food items, then definitely we can include all those items as well. So just make sure that you follow a particular, that you follow all the phases of low FODMAP diet, and accordingly definitely you'll answer that no, it's not too restrictive. Read, and definitely if I talk about the reintroduction phase, it helps you to identify a trigger. So that way we can definitely include a lot of food items, a variety of food items that are even available whenever we go out as well. So accordingly, that is beneficial. The next bit is the low FODMAP diet forever? So if you have IBS or someone someone who's related to you has IBS, so what do you think? That person has to be on low FODMAP diet forever, or they can include more food items into the diet, or how they can just change diet according to that and improve their overall gut symptoms as well? Okay, some of you are saying no, this diet is not forever. So definitely, like I would say, the people who are saying no, it's not forever. So they have heard that I've mentioned this in the previous slides as well. Like the fact about this, we don't have to be on this diet forever. Okay, no, this is not definitely not meant for a long duration of time. It is just for the 4 weeks. Yes, person should follow the diet, that diet with some of high FODMAP diet. Yes, exactly. So you have to find out the triggers during the reintroduction phase, and that way you can even introduce, like reintroduce the high FODMAP food items as well into your diet, and you can enjoy your favorite food items as well. Definitely, the low FODMAP diet, it helps the gut overall to heal, and we can like most of the people who go through over the low FODMAP diet phases, they are able to resume the normal diet easily because they identify the triggers in the during the phases, and they then afterwards they can enjoy a lot of variety of food items. Last but not the least, next myth is saying low FODMAP diet is suitable for everyone with IBS. So, do you all agree to this that a similar diet, kind of low FODMAP diet, is suitable for everyone? Like for one person, the same diet is given in even this other case who is suffering, like one person is facing constipation and the other person is facing diarrhea. Do you think the same low FODMAP diet works for all, or a nutritionist can suggest you a same pattern of diet to all? Okay, most of you are saying no, not at all. Low, there should be variation in low FODMAP diet. Anyone who says yes, like a same low FODMAP diet can be followed for each and every person. So no, like as I've mentioned, no, same low FODMAP diet cannot be followed by everyone. Even the picture depicts that a professional guidance is needed, and no same food items or the same kind of low FODMAP diet will ever benefit everyone. We have to be cautious as per the symptoms, as per the height, weight, and what the person is facing. Accordingly, only a professionalist or the nutritionist suggest you as per that only. So as per this only, I'll conclude my masterclass of today, like the Daily Bloom IBS. It comprises of various components. First is the nutrition component. In the the nutritionist in here, we guide you as per your overall requirements, your height, weight, your comorbidities, your routine. Accordingly, only we personalize your diet plan. And there are variety of recipes mentioned available in on our app that you can follow. Next is the wellness component, which there are where like there are wellness coaches as well who guide you for mental wellness, that is the stress management, anxiety management, depression management, and of course they even guide you for the physical management as well, like physical exercises. There are resources available on the app like yoga videos, there are articles, and of course there is a feature called symptom tracking, through which our nutritionists guide your symptoms, how they are improving overall, or if you're facing any symptom, they guide you according to that only. So if you have any question related to IBS, please drop in the chat section or Q&A section. I'll definitely answer to that. Yes, any of you have any doubts related to IBS or the low FODMAP diet, or how on Daily Bloom app we are helping you, please let me know. Thank you so much. Any doubts related to how you can follow, what are the food items, how a nutritionist is guiding you throughout the time, please let me know. Yeah, a question was asked earlier by Mr. Salman that I want to ask that if we are taking good diet, right, then why we feel weakness? See, definitely, if we are talking about any, for say, you are talking about weakness, so a nutritionist can guide you throughout the time as per your height and weight. Your calories and protein should be meet, and even a lot of Variety of food items should be included into your diet, and along with variety of food items there should be hydration also. So water intake is definitely needed for the same. So improve your water intake to overall so that your digestion improves. Overall I would say like your gut symptoms will improve with the intake increase of water, and also your overall hydration increases, so you will feel more active as well. So that will definitely help. And fruits and vegetables which are low in FODMAP or the high FODMAP which are easily tolerated by you definitely can be included into your diet. Can we still get any symptom, like can we still get symptoms after following the low FODMAP diet? See, whenever we talk about low FODMAP diets, if a particular food item you're exceeding the amount, for say you are having orange on regular basis per se. But if you are way exceeding that amount as well, then maybe because of the high FODMAP contents that may cause you the symptom. But if you're following low FODMAP diet and following all the tips and you're keeping your body hydrated, that way definitely that will help you to reduce weight. A low FODMAP diet is suitable as per your symptoms. So accordingly, if you are taking as per your symptoms, your professional dietitian is guiding you throughout the time and you're following it strictly, that will definitely benefit. But keeping in mind that your stress level, your sleep pattern, your hydration should be regular as well. Is rice a low FODMAP or high FODMAP? Rice is a low FODMAP food item. This can be included in your diet. And like if, for example, there are certain cereals, like if given you wheat and wheat products as food items which are high in FODMAP. But rice or other millet flours, or if you talk about oats, quinoa, these are low in FODMAP and you can definitely include into your diet. So there's a question like once the daily bloom program is complete, is there any follow-up to check up the client status? Yes, there are sessions that are like arranged according to the patient's time and like definitely your nutritionist, your wellness coach, and a person who is under the daily bloom app, they will contact you and accordingly only they will take an update. So we are even planning few more things. You can we will keep you updated with those as well. So the wellness coach or the nutritionist will definitely keep an update with you. The status, everything. Thank you so much, Dr. Manoj. Diabetes or its medication cause IBS. Whenever we talk about any particular medicine, so like I won't focus on any particular diabetes medicine. I would say there are certain medicines which increases the symptoms of IBS. Maybe constipation, maybe you are facing good diarrhea issue. So there are certain medicine which increases overall IBS symptoms. So of course we have to keep in mind and we can talk to the doctor accordingly. And along with that, you have to keep the nutritionist updated with those medicines which are increasing your symptoms. So accordingly only the nutritionist will guide you and help you out how you can improve your overall symptoms. I hope this clarifies your question. If anyone else have any question, then I can answer to that. You're welcome. I'm really glad. Thank you so much for attending the webinar. So as there are no more questions, I would end this webinar. And also I would really like to give you the information that the next week, every week there is a webinar either by the wellness coach or the nutritionist. I hope you will join and definitely it will benefit you. So thank you so much all for joining.